Good day. I'm John Lopes, the project director for the PAEA Medication-Assisted Waiver Treatment Initiative, or MAT initiative. You've likely read a little bit about me in the Networker article introducing myself and the project, but I'd like to tell you a little more about why I've signed on to this initiative. In the 1990s, there was a concerted effort to address, at that time, what was perceived as undertreated or untreated chronic pain. At the same time, there was developed a series of very potent opiate medications, which were heavily marketed in support of the initiative to treat pain, and particularly to primary care providers. So physicians prescribed these powerful opiates to hundreds of thousands of patients, and many of them developed physical and psychological dependence. There are an estimated 2 million Americans who have opiate use disorder, with about 500,000 of them using heroin on a regular basis. For the last 9 years, I've worked in opiate treatment at a methadone clinic, treating patients with opiate use disorder, and many of these patients started with a prescription for pain. And even with the increase in the number of opiate treatment programs, such as the one I work in, and providers who are waivered to prescribe buprenorphine, there still exists a considerable gap in the availability of access to effective medication-assisted treatment. As you know, the Comprehensive Addiction Recovery Act, passed and signed by President Obama in 2016, provided a time-limited window for physician assistants to take the training and apply for and receive the DEA data waiver to prescribe buprenorphine for medication-assisted treatment. The PAEA is committed to being part of the solution to the opioid crisis by helping facilitate the inclusion of the MAT waiver training into PA program curriculum. The goal of this initiative is, first, to have PA programs implement MAT waiver training in their curriculum, and to have this incorporated by the end of the grant period in 2020. The vision of the PAEA is to see that 100% of PA program graduates receive the MAT waiver training. We know that not everybody will apply for the waiver, but we're hoping that this will increase the supply of providers prescribing buprenorphine for medication-assisted treatment. A second component of the grant is for programs to have their students apply for and receive the National Provider Identifier number. This number will facilitate a number of things, including the ability of programs and the PAEA to track and monitor graduates to see if projects like ours are successful in meeting its goals. As project director, my job is to assist programs with the implementation of the program requirements for MAT waiver training, to help develop resources to assist in this implementation, and assess the success of the grant in meeting its goals. Please don't hesitate to contact me. My email and phone number are on the webpage, and I'll be happy to assist you in any way. Thank you for your attention to this important initiative, and thank you for your participation with our goals.